Hello everyone and welcome to our Nutrition in Pregnancy class. My name is Kira, I'm one of the dietitians here at the Rotunda, and I will be taking you through our general nutrition for pregnancy. Let's get straight into it with the question, why is nutrition in pregnancy even important? So we all know that the nutrition that mother consumes during her pregnancy has a strong influence on the health of her fetus during the pregnancy, but also long lasting into the remainder of their life. And the better our diet is during pregnancy, the less there is a risk of developing obesity, metabolic syndrome, and type 2 diabetes in the child long into their life. And this hypothesis is known as the Barker hypothesis for anyone that has an interest in the area and wants to do some further reading. One of the main myths when it comes to nutrition in pregnancy is that we are eating for two. Unfortunately, in terms of energy requirements, portion sizes, and the amount of food we must consume for a healthy pregnancy, this isn't necessarily true. We do have increased requirements for particular nutrients, most importantly, things such as protein, vitamin D, iron, healthy fats, and calcium, and some other ones. More specifically, in the second trimester, there's an increase of 250 calories and 10 grams of protein every day compared to pre-pregnancy. Moving into the third trimester, there is an increased requirement of 500 calories and 25 grams of protein in comparison to pre-pregnancy. It's important that we focus on some key nutrients, such as those that I explained: folic acid, calcium, protein, vitamin D, iron, iodine, and more. And we are going to get into what those look like and how we can meet those increased needs in a moment. I'm going to start by looking at our macronutrients, which are carbohydrates, proteins, and fats. These provide us with energy and are also the building blocks for growth and development in both mom and baby. First and foremost is carbohydrate. This is another word for sugar. Unfortunately, carbohydrates have a bad rep, and there is increasing popularity in dietary patterns such as low carbohydrate and ketogenic diets. These are not recommended to follow during pregnancy. Carbohydrates are our main source of energy for mom and baby, and for that reason, we recommend taking them regularly, which is at each and every meal. We have better sources of carbohydrates, and these include our whole grains. So things such as whole grain bread, crackers, bran-based cereals, potatoes, sweet potatoes, yam, whole grain rice, and whole grain pasta. And these are great for long-lasting, slow-releasing energy. They also come packaged with other vitamins, minerals, and fiber, which is great for our gut health. Natural sugars occur in fruit and dairy products such as milk and yogurt, and again, these are good sources that should be included regularly in the diet. Some examples of sugars that we aim to reduce are free or added sugars. These may include table sugar, honey, maple syrup, agave nectar, golden syrup, soft drinks, smoothies made on juice and fruit without any source of protein, and fruit juices as well. So these are typically higher in our free or added sugar, which we do like to reduce throughout the day. Protein is our next macronutrient. This is most important for the growth and repair of muscle, and this becomes more important as the pregnancy goes on. Requirements for protein increase after 20 weeks. We can get away with having 2 servings per day in the first half of pregnancy. Those with a singleton pregnancy will require 3 servings per day after 20 weeks, and those carrying multiples will require 4 servings per day. In order to identify what a portion size looks like, you can use the palm of your hand for an individual assessment. So looking at the palm of your hand, having 1 palm per day will meet your 2 serving requirement. Another way of assessing your protein intake is 1 serving may equate to 50 or 75 grams of cooked beef, lamb, pork, poultry, or mince, 100 grams of cooked fish, soya or tofu, 3/4 of a cup of lentils or beans, or 2 eggs. We encourage minimizing our protein intake from more processed red meats. So these include high fat steaks or mince, bacon, sausages, and other processed meats as they come packaged with other nutrients such as high salt content that we do want to avoid. A quick note on protein supplements: we do not currently recommend ingesting protein supplementation as they have not been around long enough to identify if they are safe or not during pregnancy, and for that reason, we do recommend staying away from those. This includes protein shakes, protein bars, and protein pancakes. Our last macronutrient is fat. This is another important source of energy, and it's very important for babies' growth and development. It has a key role in the development of our brain and our nervous system, so definitely not one to skip out on. As with all of our macronutrients, we have good sources and we have sources that we do tend to minimize. And a lot of us do receive most of our fat content from the less of our healthy sources. So it's important to be aware of what those are. Opting for good, healthy fats include oily fish such as salmon, herring, mackerel, and trout, nuts and seeds, olives or olive oil, eggs, soy products such as tofu, avocado, hummus, and some other plant oils such as rapeseed and canola oil. We do want to minimize our intake of processed foods and takeaways, anything that is deep fried or crumbed, as well as confectionery and processed red meats such as bacon and sausage. In specifics, our healthy fats are omega-3s. The best sources of omega-3s are oily fish, as I have already mentioned. During pregnancy, it's recommended to take 1 to 2 portions per week, but we do not recommend exceeding this intake. If you are meeting that requirement, we don't recommend taking a supplement as you are reaching those omega-3 needs. If you're relying solely on plant-based sources of omega-3s, you are likely not getting adequate amounts, and therefore we do recommend considering an omega-3 supplement. Be careful to check the ingredients and make sure it is a pregnancy-safe supplement, and avoid cod liver oil as these are not the same product. Moving into our micronutrients, so our vitamins and minerals. We're going to dive into folic acid, vitamin D, iron, iodine, and calcium. Folic acid is an important nutrient to consume through supplementation before and throughout the pregnancy. It has an influential role in the development of our spinal cord, and it is important to have in the diet or in the supplement at adequate doses in order to prevent the development of neural tube defects such as spina bifida and encephalopathy. Most women during their pregnancy will be recommended to take 400 microgram supplement of folic acid for 3 months prior to conception and for the duration of the pregnancy. There is new guidelines from 2019 that support continuing to take folic acid into the second and third trimester and not stopping after the first trimester. Some women will require a higher dose supplement of 5 milligrams that will be prescribed by your GP if you have a BMI of over 35, if you had had a previous birth affected by a neural tube defect, or if you have diabetes, and this is something to bring up with your GP. Folate is also found in foods such as fruits and vegetables and whole grains, but there is not adequate amounts of folic acid to meet our requirements through diet alone. Iron is a very important nutrient as well, and you will be tested for your iron levels at your booking visit. If you don't hear from the hospital, that means that your iron levels are okay and you will not require an additional supplement at that time. It's important to be aware of iron in the diet as we get most of our iron through animal meats such as red meat, fish, chicken, and poultry. We can also consume iron through eggs and black pudding. There are plant-based sources of iron as well. These include edamame beans, lentils, chickpeas, black beans, baked beans, dark leafy greens such as spinach, tofu or other soy-based products, and whole grains. So it's important that we get in a nice variety of iron-containing foods every single day. Iron is important to help prevent anemia, and it also aids in the carrying of oxygen around the blood and to the baby. It has a significant influence on a healthy birth weight of your baby, as well as brain development. So very, very important nutrient. Interestingly, babies do not receive iron in their diet after birth for the first 6 months of their life. And this means from 25 weeks of pregnancy, they start to store iron for themselves. And that is why mothers' requirements are highly increased. And it's important to stay on top of your iron intake at this time to prevent anemia. When we look at our plant-based sources of iron, it's important to always consume with a source of vitamin C. This may include berries, oranges, lemons, red bell pepper, or tomato. So when we're having whole grains or breakfast cereals, make sure to include a source of vitamin C. It's also important to avoid tea, coffee, and calcium supplements 30 to 60 minutes pre and post meal, as this may hinder the absorption of iron. Calcium and vitamin D are important not only for healthy bones and teeth, but also for regulating our blood pressure. So it's important to meet our calcium requirements of 3 to 5 servings per day. If you are carrying multiples, or if you are a teenager, your calcium requirements are 5 portions per day. 1 portion of calcium may be easily consumed through dairy products such as a glass of milk or 125 grams of yogurt. You can also get this through 30 grams of hard cheese. There are some other sources of calcium, including dark leafy greens like spinach and kale, nuts and seeds such as peanuts and sesame seeds, as well as tinned fish like tinned salmons and tinned sardines. So on reflection, see how many portions you get per day, and hopefully it's between 3 to 5 range. Vitamin D is important for the absorption and utilization of calcium in the body. In Ireland, it's recommended for all women during their pregnancy to take a supplement of 10 to 15 micrograms per day. This will be available in your pregnancy multivitamin if you are taking this. We can also fortify our diet through foods such as oily fish and fortified dairy and eggs that have had added vitamin D to boost your intake. Our last key micronutrient is iodine. This helps with brain development and learning in the fetus and child into their later life. Our dietary requirements increase by 50% during pregnancy, which is a huge increase, and it is because we are utilizing iodine in the development of the brain and nervous system. The best sources include white fish and dairy, such as milk, yogurt, and cheese. Iodine is also available in a supplement form and is in pregnancy multivitamins. It's important to avoid seaweed as a source of an iodine supplement, as this is an unregulated product that is unreliable in terms of its iodine sources. Now that we have gone through what nutrients we need, it's important for us to see how we can adapt that into a meal or a plate. Here we are looking at the plate model. This looks at how we should be portioning out our meals in our dinner plate or bowl. This is also relevant for lunch and breakfast. So this is a nice visual representation of how we should introduce fruits and vegetables, whole grains, lean proteins, and healthy fats. As you can see here, half of our plate should be coming from a variety of vegetables, which are nice and colorful. So always aiming to represent the rainbow in terms of different colors that we introduce to each meal. We get our lean protein sources as we have gone through, so things such as eggs, chicken, fish, and plant-based sources such as lentils and beans. That will be accounting for a quarter of our meal, and the other quarter should be coming from a starchy, whole grain carbohydrate such as quinoa, brown rice, brown bread, or spaghetti. We also need a serving of unsaturated fat, so for example, an olive oil salad dressing. We aim to have 3 meals per day with 2 to 3 nourishing snacks. Also opting for water as our main source of hydration and fruits as a nice snacking option. A quick note here, if you're following a vegetarian or vegan diet, our vegetables and our grain intake will be the same as following an omnivorous diet. Our plant-based proteins are of importance here. So making sure we're consuming edamame beans, lentils, chickpeas, nuts and seeds, or tofu or other soy products regularly throughout the day to meet your protein requirements. We need to pay close attention to calcium and make sure that dairy alternatives have added calcium to the product, which can be found on the label. Those following a vegan diet will require a vitamin B12 supplement as well as a vitamin D supplement, like everyone during their pregnancy. Iodine is also an important nutrient here, as we know it is only available in white fish and dairy products. Some examples of balanced, healthy meals that may not be represented on the plate model but are also very great sources of nutrition. Something like a whole grain sandwich with chicken, cheese, and salad, soup made with chicken or lentils for protein, vegetables, and a whole grain roll, a pasta or pasta salad with tuna and sweet corn, a burrito bowl with pork, beans, shredded cheese, rice, and chicken or tofu stir fry with noodles and vegetables, roast chicken with potatoes and carrots and any other vegetable that you like, a homemade burger on a whole grain bun, and corn on the cob. Those are just some examples. Similarly, we all struggle to meet our healthy snacking requirements. So this is some inspiration for you for a well-balanced, nourishing snack. Fruits, nuts or trail mix, crackers with cheese, oat crackers with banana, yogurts with fruit and granola, brown bread with avocado and tomato, apples and nuts or nut butter, popcorn. You can mix that with trail mix as well. We can also have maybe a slice of bread with tuna and sweet corn, hard-boiled eggs, and some crackers or oat cakes, or maybe a whole grain scone with yogurt. So loads of examples there to help you meet your energy, protein, and micronutrient requirements. The key supplementation recommendations in pregnancy are folic acid 400 micrograms and vitamin D 15 micrograms. These will be available in a pregnancy multivitamin. It is important to take our other supplements at an individual basis. So iron, omega-3s, iodine, and calcium, depending on what your diet looks like, and always double checking that the supplements that you are taking are safe and recommended in pregnancy. A quick note here on hydration. In order to meet our hydration requirements, we should be consuming at least 8 cups of fluid per day. And this does not only have to include water. You can use any fluids such as dilute, fruit juice, milk, and herbal teas. A good practice to get into is looking at the color of your urine to assess your hydration status. We are aiming for colors 1 to 3 on the chart here on the left. If you notice that your urine is darker, so between 4 and 8, it's very important to increase your fluid intake, and if necessary, look for medical attention to support your hydration levels. Many of us are concerned about gestational weight gain and are not sure how to track adequate or healthy weight gain. Weight gain requirements are based on your starting BMI or body mass index. So if you enter pregnancy with a healthy BMI, you will be expecting to gain 0.4 kilos per week, which is similar to 1 pound per week. And as you can see, starting with a lower BMI or higher BMI will have slightly different weight gain recommendations. If you're carrying twins, the recommendations are different and you see a higher rate of weight gain. So for example, normal BMI is 0.75 kilos per week, which is about 1.25 to 1.75 pounds per week. So it's important to always be assessing based on your individual BMI and following as routine. Many questions come in around food safety and food hygiene. I'm going to touch on some of the main concerns that we hear and foods to be aware of. So let's start here on the left with eggs. In Ireland, it's currently recommended that we can only consume well-cooked or hard-boiled eggs. This means that the yolk must be hard. Caffeine. So our upper limit of caffeine is 200 milligrams per day, which is equivalent to 2 cups of coffee or 4 cups of tea. Be wary that fizzy drinks and chocolate also contain caffeine, which can add up. Cheese. There's many cheeses that are safe to consume during pregnancy. So this is mainly our hard pasteurized cheeses, such as mozzarella, cheddar, Edam cheese. It's important to be conscious of soft or mold-ripened cheese, such as brie, camembert, and blue cheese. Unpasteurized cheeses should also be avoided, and it will be noted on the food label if it is unpasteurized. Moving into our seafood, smoked salmon is not recommended during pregnancy unless it is well cooked, and all animal products such as meat and fish must be well cooked to consume during pregnancy. There are some other fish that we avoid due to high mercury content, and these include shark, marlin, and swordfish. Mollusks such as clams, mussels, oysters, and scallops must not be consumed during pregnancy, even if they are well cooked, and this is because of a potential toxin that might be present and is not killed off through cooking. We also have recommendations and maximum levels of fish intake during pregnancy, which is twice per week. So, for example, 2 tins of tuna per week is your higher dose of fish intake during pregnancy due to the risk of high levels of mercury. Vitamin A is excessively high in liver products, so things such as pate and cod liver oil, and these are to be completely avoided during pregnancy. We do get questions regarding nuts. So nuts are safe to consume during pregnancy only if you are not allergic to them themselves. They will not introduce increased risk of allergy in the fetus. And one other food to mention is our soft serve ice creams, such as a 99. Unfortunately, these are to be avoided during pregnancy because of the risk of listeria from the storage of this ice cream. Food hygiene. This is the same as it is outside of pregnancy, but is just that much more important during your pregnancy. So it's good to recap on the important practices. So washing your hands before handling food, eating your foods before the use by date, separating the storage of cooked and uncooked meats, cooking your food thoroughly. So this includes boiling your eggs until the yolk is hard and having your meats well done. Using a different chopping board for cooked and uncooked meats to avoid cross-contamination, washing your fruit and veg with water, and keeping your storage in the fridge and freezer at the optimum temperatures of less than 5 and less than 18 degrees appropriately. I'm going to touch on some of the key symptoms with regards to pregnancy and some lifestyle changes that we can make to support you if you are experiencing these. Nausea and vomiting is very common. One thing that we do recommend is eating little and often. And there are no foods that are off limits when it comes to pregnancy sickness. The most important thing is staying on top of your food intake and hydration as well. Most women find dry plant carbohydrates easier to consume and easier to digest and keep down. But as always, you should listen to your cravings and listen and try foods that sound good and appetizing for you. This is an example of a meal plan that you may follow, which includes eating in a little and often approach. So as you can see, having small snacks that include carbohydrate-rich foods and fluids every hour on the hour where possible. It's important to note that if you cannot hold anything down, you should attend the emergency room for medical review. There are many medication options that can help you address your symptoms of nausea and vomiting during pregnancy that are important to explore with your healthcare provider. Constipation is another common symptom, and we do tend to see this especially in the first trimester of pregnancy. There are the 3 F's of constipation to help reduce this occurrence. Firstly, meeting your fiber intake requirements. We can do this easily through meeting fruits and vegetables with the portions of 5 to 7 per day. Also opting for fibrous foods in our whole grains, such as brown breads and brown pastas, and also introducing pulses such as lentils and beans into the diet regularly. You may also gain benefit from introducing flax seeds or chia seeds into the diet every day. Meeting your fluid requirements is very important for constipation, especially if you are increasing your fiber intake. So aiming for at least 8 cups of fluid here, or if you're already dehydrated, bumping that up to 11 cups per day. Lastly, engaging in regular physical activity is important for overall health and well-being, but also can help reduce symptoms of constipation, as it helps direct blood flow to the gut and keeping the peristalsis, or the contraction of the gut muscles, moving to support regular bowel motions. Lastly, heartburn is another common symptom. Unfortunately, the prevalence of heartburn is caused by an increase in the pregnancy hormone. So unfortunately, there's not much we can do to tackle the source of heartburn, but you might notice that you have some triggers in response to certain foods, such as spicy foods, high fat foods, such as takeaways or deep fried food, chocolate, and caffeine. Also fizzy drinks and chewing gum. So if this is relevant for you, you can avoid your triggers. You can also try eating small, frequent meals to reduce portion sizes, sleeping up at an angle if the heartburn does get worse at night, and opting for loose, comfortable clothing to reduce the abdominal pressure and hopefully reduce the severity of heartburn. And just to note, there are medical treatments available, so important to discuss this with your doctor or pharmacist. Physical activity at the recommended dose of 150 minutes per week of moderate intensity is very important. So if we break this down, it's about 30 minutes 5 days out of the week. And this doesn't need to be in one 30-minute block. You can break this up into 3 by 10 minutes or 2 by 15 minutes, just as long as you're doing exercises that you enjoy and that you can keep up. So have a look here at some inspiration for different ways that you can get the most out of your exercise. If you're interested in doing a Pilates style exercise that is pregnancy focused, you can head to a free resource on YouTube, the Bump Room, which are pregnancy safe Pilates classes that have been put on by Irish physiotherapists, and a lot of women love to engage in these classes. I wanted to highlight the benefits of breastfeeding. So not only for mother, there's many benefits associated with the development of the fetus and child into their early life and later in life. So it can reduce the risk of chest infections, middle ear, and GI infections, and it also is protective against obesity and cardiovascular disease later in life. It helps promote cognitive development, and it is liquid gold. So the composition of breast milk is the perfect combination of different nutrients in the right amount for baby. It's a cheaper option than bottle feeding. It also helps reduce the risk of ovarian and postmenopausal breast cancer, and can reduce the risk of cardiovascular disease, obesity, and type 2 diabetes. It does also introduce a very strong relationship and bonding between mother and baby. There's some great resources available online at mychild.ie through the HSC, and you can also get in contact with the lactation specialist in the Rotunda if you meet the criteria for the breastfeeding wraparound clinic, which is here. So some examples include a history of low milk supply or difficulties with breastfeeding, diabetes, elective C-section, no changes in your breast throughout pregnancy, or hypothyroidism. So don't hesitate to go onto the Rotunda website or contact the lactation specialists here. And one last note on gestational diabetes. Who is at higher risk? Women with a BMI of over 30, a maternal age of over 40, family history of diabetes, previously given birth to a large baby of over 4.5 kilos, and certain ethnicities. In order to reduce your risk of developing gestational diabetes, it's important to follow our healthy eating guidelines, as we have just gone through in today's presentation: eating regular meals, opting for whole grain carbohydrate choices, reducing your intake of free sugars, engaging in regular physical activity, and staying within the recommended healthy gestational weight gain guidelines for your BMI. If you have any other questions, you can feel free to contact us at the dietetics department here in the Rotunda, and also have a look at our other resources available on the website. Thank you so much for watching.